Hello, welcome everyone. I'm so excited to be sharing tonight with you. Thank you for joining us. First off, just want to invite everyone to take a deep breath. You made it, you're here, you've carved out this hour to learn and have an awesome discussion with Dr. Hsu. Where's everyone dialing in from tonight? Everyone, let us know in the chat. Would love to see where everyone's coming in from. Awesome. I see LA. Seattle. This is great. Austin, Fresno. Fantastic. Cleveland, San Diego, SF, Pleasanton, Redwood. Oh, love to see it. This is great. I hope everyone's having a fantastic day today. My name is Marissa. I'm one of the co-founders of Beaming Health. We're a free resource for neurodiverse families like yours and mine to help navigate all of the different hurdles life throws our way. We're so lucky today to have Dr. Melanie Hsu to talk about autism. Melanie is one of a kind. Apart from being an incredible clinician, she's an incredible person. She's worked with hundreds of families in her 15 years as a clinician, working to help families get answers and understand things around autism. But before we jump in, a few quick housekeeping items. First, a giveaway. So for everyone who's joining us here live tonight, 3 lucky attendees will be getting $25 Amazon gift cards. I know. Let's go. All you have to do to be one of these lucky 3 is join our online community during tonight's event. You should see a little pop-up on your screen there to join the community. If you go to the site, create an account, there'll be a post for you to comment your favorite children's book, and we'll announce the winners at the end of the session. As far as tonight's event, Dr. Hsu will give a 30-minute presentation, during which you can feel free to jump in with questions in the chat throughout. We want this to be as engaging as possible. And lastly, we will record the session for all of you joining here tonight. You can go back and rewatch anything you want to hear again. And for anyone who wasn't able to join us live, they'll be able to hear all of the wonderful thoughts shared. And with that, without further ado, Dr. Hsu, take it away.
Hi, everyone. It's so nice to be with you this evening. As Marissa said, I am a clinical psychologist, and I'm happy to be here today to have a conversation with you guys about autism and about some of the neurodevelopmental aspects of autism and how to help your child thrive. So first of all, I'd like to start off with just a very quick synopsis about me, mainly so that you'll understand, why should we listen to you, as well as, most importantly, what my biases are. So credentials aren't everything, but they definitely help people get an idea of a person's background and, again, most importantly, what their biases are. So as you can see from this quick summary, I am a clinical psychologist by training, and my emphases have been in child and family. And so I will try to say individual, but sometimes I will slip up and say child, just because my clinical practice is with children. So as you can see from here as well, I work in both intervention as well as in assessment, but I also am involved in research with Kaiser Permanente's Autism Research Program. And so with this, I am able to do a lot of different things, but my passion has always lain with being able to help families understand their children from a very comprehensive background. As clinical psychologists, we are trained to take a lot of information and break it down into small pieces and then put everything back together to help people have comprehensive understandings of what's going on in the situation and to create a story for families to be able to use. And so this is part of kind of why we wanted to start off this conversation with just a little bit of background so that we're all on the same page. But mainly, we really want to also be able to have a conversation with you guys and really make it useful so that you can ask questions and engage with us. Okay, so really quickly to start, we're going to start this conversation with, again, just some information to ground us. So autism spectrum disorder is a disorder that has core difficulties with social emotional reciprocity, or being able to understand social nuance, being able to freely go back and forth in social interactions. The following 2 bullets are the criteria that we see in the DSM, which is the manual that we use to be able to make a diagnosis of autism. And so, as you can see, the two main areas are social communication, or being able, again, to understand social relationships and to be able to use communication, both verbally and non-verbally, to be successful in social interactions. And then the last area is restricted and repetitive behaviors, or RRBs for short. And so sometimes people get confused as to why RRBs, or restricted and repetitive behaviors, are included in a diagnosis of autism. And so part of what we're going to be doing tonight is understanding how all of these things fit together and where some of these difficulties are coming from, so that we're all understanding how to best support individuals. Okay, so again, autism spectrum disorder is a neurodevelopmental disorder. And so this is why before we were talking about neuropsychological underpinnings. Autism is part of a group of neurodevelopmental disorders. Other things include ADHD, or attention deficit hyperactivity disorder, for example, sensory processing issues, speech and language issues as well. And so there is a large number of neurological underpinnings to neurodevelopmental disorders. And so, again, there are many things that have a neuropsychological root, which is what we're going to be talking about a little bit later. There is also a large genetic component, and because it is part of a bigger constellation of neurodevelopmental disorders, you'll often notice that it overlaps with many other diagnoses. So it's not uncommon, especially for me as an assessor, to see children a little bit later in life who have had multiple other diagnoses. And even though a lot of times parents start noticing differences in the first 2 years of life, sometimes not everything is as well understood until later, especially for higher functioning individuals, or, for example, cisgender girls are often diagnosed significantly later than cisgender boys. So one of the important things in clinical psychology, for example, is to help understand all these different components to say what might be causing these difficulties and how do we address them in a way that's comprehensive and not just targeting one area, but understanding the child or the individual as a whole. Okay. So another important thing to keep in mind is that we're looking at a spectrum. And so one of the reasons why the diagnosis changed from autistic disorder and Asperger's disorder to autism spectrum disorder is to acknowledge the fact that everything lies upon a spectrum. And so again, we are not trying to pathologize the wide range of behaviors that we see, the neurodiversity that is part of what makes us as humans unique and special. What we're looking at is when behaviors or other symptoms are causing clinically significant difficulties, or areas that are making it harder for them, for an individual, to be able to participate in what they need to do to be successful. And so there are normal behaviors, or behaviors that are widely seen or commonly seen. There are atypical behaviors, or behaviors that are unique or don't lie within the spectrum of what we normally see. And then there are clinically significant behaviors. And so with autism, we're looking at particular clusters of behaviors that go together that altogether equal autism spectrum disorder. So this concept of spectrum and how this is also going to be important for some of the things that we're going to talk about later. But in general, understanding that we are looking at behavior along that continuum is an important concept to think about. Because again, we don't want people to think, again, that we're just saying, well, this is not what's normally seen, therefore it's problematic. It's, again, trying to remove barriers for people. Okay, so another concept that's going to become important in how we talk about later things as well is the concept of hierarchical progressions. So in development, we talk about how early areas of development build upon each other to continue to move along development. So this is important because if we understand how behaviors and how development builds upon each other, you can see where potential breakdowns are. And so an example that we, especially us child psychologists, really like to use is play. And so play begins with sensory exploration. And so again, you're using your senses to make sense of your world. And so that's where you start. And that's why a lot of times babies, for example, everything goes in their mouth, or they're looking at things really carefully, or they're touching and feeling. They're using their senses to make sense of their world. This then, once you understand again how the world is and how you interact with it and those effects back and forth, builds into functional play. And so this is kind of that pre-academic play where you start to recognize attributes. So things like colors, categorization, putting puzzles together, and understanding again that level above just understanding what something is. It's how it works together. That then progresses to symbolic play, where something can take the place of another. So, for example, your spoon isn't just a spoon, it's also a plane. And so, as you can see, that's one more step beyond just understanding the physical attributes, figuring out how it works in conjunction with something, but also then imbuing it with life. This then leads into social play, which is your ability to role play, for example, and to take on the thoughts and feelings of others. So, one of the reasons why us psychologists go on and on about play so much is this is actually the way that children learn theory of mind. So, theory of mind is that understanding of how others think and that they have different thoughts, feelings, and experiences than you. So when you see your parent or another adult doing something, you take on that persona and you try it on, just like you try on a costume. And you're seeing, again, things through their eyes, and you're understanding how all those things fit together. And that's where that social piece comes from. But as you can see, sometimes an individual can get stuck in one of those stages and doesn't move on kind of to get to that top of where this should be leading. Communication is another really good example for this. For example, communication starts with communicative intent. So understanding that you can have an effect on someone else. And then the motor planning to be able to make certain sounds. And then the memory that certain sounds mean certain things, because language is very abstract. And then once you put all those things together, knowing the social context that communication is for. As we know, communication doesn't always work in every single situation. You have to shift your behaviors. And so you can see how that social piece gets woven into every single part of development. But that, again, you can see those breakdowns sometimes that may be getting in a person's way and being able to kind of put all these things come together. And so understanding all of these things also helps us understand where are behaviors coming from? Why does an individual engage in certain things? Because nothing happens in a vacuum. And understanding these from a basic part helps us be able to put those together again to say what is causing a problem or a block for this individual. So this is probably the most complex part of the presentation that we have today. This is called the pyramid of learning. And what we really like about this, which is all the way back, it came all the way back from 1991, is an understanding of how we, again, use hierarchical progressions to continue to move forward in development. So as you can see, on the bottom of this pyramid is the central nervous system. And then on the top of it is academic learning, or the intellectual cognitive part of how everything comes together. So you can see again, when we were talking before about neuropsychological underpinnings, we were talking about development in general. With autism spectrum disorder, because it is a neurodevelopmental disorder, there are many things neuropsychologically and neurologically that get thrown off that often will lead to more problems. And just like with building a house, if you don't have a strong foundation, you can see that there's going to be more difficulties the higher up you go. Excuse me. So our central nervous system lies on top of, or lies below, our sensory systems. Our sensory system is the way that we take in information from our environment and make sense of it, and how we can interact with the world accurately, as well as efficiently. Sensory processing is also the basis of regulation. So being able to be in a state of not of being efficient, for example, and not being either overstimulated or having too many things go on, or understimulated where you need to do things to kind of wake yourself up. Many of us take these things for granted because our nervous system works the way that it's supposed to, and we don't have to worry about filtering things out or getting more sensory information in. And so, even from a sensory perspective, this is one of the reasons why it's one of the symptoms of autism spectrum disorder. It's often one of the first things that parents notice. My child moves more than they should, or they get overwhelmed more than they should, such as like with sounds or with touch, or they're constantly moving and seeking those things out. So when your nervous system isn't working the way that it's supposed to, again, your body isn't as efficient. And so you use more energy for the things that should come naturally. And so this is, again, just that bottom part. And we haven't even kind of gotten into some of the other parts that go into it. So sensory motor development is that next part that lies on top of sensory processing. So again, being able to put things together, being able to, for example, understand where you are in space, being able to understand the two sides of your body and how they work together. Something that I forgot to mention earlier is that most people are familiar with the five senses. So your sense of hearing, vision, sound, touch, taste, and then occupational therapists talk a lot about these other two systems, vestibular and proprioceptive. And so again, the movement of your head through space is vestibular, and proprioception is understanding where you are in space. And so again, these are all the bases for regulation. And so on top of that, then making sense, just like we were talking about in play. So you go from making sense of your world through your senses to then understanding then how you interact with your world. And then as you go up, you can see then you start building in more processes. So starting to do hand-eye coordination. As you can see, this is going to be more important for things like being able to do activities of daily living, like brushing your teeth. Also at school, being able to write, being able to catch a ball, doing these things that we, again, typically expect children to be able to do without needing a lot of effort. And then that goes up again into the cognitive and intellectual part where everything comes together, your sensory systems and your motor abilities. And then we start adding in the social piece, because there are times when the activity of daily living should be done this way, and then times when it should be done another way. The same thing with behavior. If you're not regulated, and again, if you are less efficient, you're using more energy, it's kind of like you have a less efficient car engine in a lot of ways. And so we have some people cruising down the highway in their Priuses getting 55 miles a gallon. And then there are some who, again, because there's a lot more going on for them, are more like Suburbans getting 12 miles a gallon. But everyone has the same gas tank. And so that's why at the end of the day, you can be in very different spaces depending on what's been going on. We all feel this as well. When we've had a really hard day, how we come home can be very different, especially if we have something like a cold or something else is going on. And so even when it comes to things like your nervous system and understanding like your sensory things, there is no getting away from sensory input. And so that can be very overwhelming and take a lot of energy for children. So why is this all important? Because academic learning is all the way on the top. And again, this is how, again, most children this is what they're expected to be able to do. But research has shown us time and time again that learning takes place best in a place of joy. And so if you're already, again, your gas tank is going down really, really fast, and because you're not as efficient, going through things like school, where you're expected to learn new things basically every day, is going to be a lot harder. So making sure that a child is regulated or an individual is regulated helps them be more available to learn, as well as to do all of the things that don't come as naturally. So the social pieces and how everything fits together. When we were talking about communication earlier, we kind of emphasized how there are many, many component pieces to things, again, that we take for granted. We feel this, I think, a lot when we try to learn another language and we realize, okay, like, just making the sound sometimes is just hard enough, not to mention putting everything together and making sure that it makes sense to the other person. Okay, so when you're not dysregulated, this is what leads to those difficulties with those restricted and repetitive behaviors. And because, again, autism is a neurodevelopmental disorder, this is why restricted and repetitive behaviors are part of the criteria for autism. We often see a lot of the RRBs that we see, such as preoccupations, sensory sensitivities, rigidities. A lot of them are also an individual attempting to regulate themselves or take control over a situation to, again, make the inefficiencies in their system, cut out the things that aren't as important. If you can control everything, you know how to anticipate it. That takes less energy. And then, of course, we always need to refill our gas tanks. And so you will go towards things that you really like, you're very good at, and that is going to refill your gas tank. Okay, so this is kind of just a representation of everything that we've said. And so individuals are that tiny little arrow in the middle, but it's a combination of communication, regulation, and social skills. And so this is how we understand autism. And this is what we also call operationalizing the question, and why most evaluations for autism have a component of speech and language, occupational therapy, which looks at, again, regulation and sensory motor, and then and psychology, which is where the emotions and social skills also come in as well. And so this is the basis that we wanted to kind of put out there so that everyone, to frame our conversations together. And so I'm going to pause here and see if we have any questions.
Awesome. Dr. Hsu, thank you so much. That was a really helpful foundation. I know I learned a lot. All right. And now we'll move into live Q&A. Dr. Hsu is excited and eager to answer any questions that anyone has. You can go ahead and throw them in the chat. All right. And let's see. Okay. First question here. Let's see. Awesome. Great questions. Great questions. First off, we have, how do we prioritize services like OT versus speech versus social skills? Which ones are most important, I think, is the spirit of the question.
That I do get when working with families. It can be very overwhelming to try to kind of prioritize everything. What we always say is, again, regulation is at the base. So you need to be well regulated in order to be able to learn things. And so what we often suggest is looking at whether or not a child is more, or an individual is more dysregulated. And OT can help, again, with making more sense of sensory information. So again, your body is more efficient in being able to be accessible. Functional communication is a really big part often of dysregulation, which makes a lot of sense. If we feel like we can't talk about what's going on for us, as well as we don't have the words to put our experiences into a way that other people can understand, that often causes a lot of frustration. And so often we talk clinically about making sure that the regulatory systems are working correctly and that the individual has a way of communicating functionally, and prioritize it this way.
Mm-hmm. Great.
And then social skills are on top of that.
Love it. Makes sense. Next, we have a question about ABA, wondering, is ABA the best therapy?
Yeah, so ABA is very popular because it is very, very well studied. And there's a lot of really great things about ABA because it is very data driven. So you're constantly evaluating and constantly moving forward. I think the important thing is that ABA is really great at some things, but not so great at other things. And especially with individuals, you have to look at what you're targeting. So ABA is really good at teaching specific skills. For example, if you're trying to teach a specific skill, ABA is really great at that. It's also great at trying to teach other ways of regulation, for example, and minimizing some behaviors that may be harmful. So there are some individuals, for example, who engage in a lot of self-harm. And so it's very good at targeting some of those things as well. As a psychologist, I often like broad-based, developmentally based programs that have a component of ABA, but also do other things as well. As we've talked about, like understanding the regulation piece, understanding the communication piece, and then insight-based things can be really helpful. So ABA can be really good to as part of a larger comprehensive program.
Mm-hmm. Awesome. Super helpful. I know that's a controversial one. Uh, all right. From Cheryl, is there a good resource for teenagers who need help socializing?
Yeah, there are some really good resources. And I think that's something that we'll need to post in the community later, just because I don't have a lot of the like URLs and those things memorized. But Evo Libri is a really good resource. For example, Social Thinking has some really excellent resources as well. But yes, we can definitely talk about that more in the community, where I can actually get to my list of referrals.
That's perfect. Yeah, we'll share some more of those in the community for sure. I love this one from Martin. Better understanding why there has been a rise in the diagnosis of ASD, or is there actually, what is driving? We saw the CDC recently came out and said now 1 in 44 individuals in the US have been diagnosed with autism. So anything you can share about that would be great.
Absolutely. So the research seems to show that there are a couple of things that are leading to the rise in the number of diagnoses. The first one really is we're looking for it. So way back in the day, autism used to have a very, very narrow definition. And again, there wasn't as much knowledge about the many different ways that autism can appear. And so many people thought, again, of more classic presentations or more severe presentations. And as we studied the ASD and just again how many different individuals can present, there was a better understanding of, again, the fact that there are neurological underpinnings that can help us understand how this manifests in many different ways. So part of it is that we're better able to look at the subtleties. Another part of it is because there was a recognition of how important early intervention and early diagnosis is. We screen basically everyone now. So there are universal screenings that are mandatory in California, where the children are screened at every single well visit, and there was again a larger number of children that were being referred for evaluations and for services. So not just autism, but other developmental delays, language delays. We are doing a better job also of treating providers to listen to parents. Because a lot of times parents would come to a provider and they would be like, well, but they're doing fine in school, or but, and wouldn't necessarily follow through with what the parent may have been concerned about. There are that is kind of where most of the research is in terms of why there is an increase in diagnosis. We understand it better. We're looking for it. We're looking very hard, and we also made the umbrella wider because we understood that a lot of people could benefit from services. And unfortunately, especially in the United States, you need a diagnosis often in order to be able to get services. And so there's also been that policy also drives diagnoses as well.
Awesome. That was great. Super helpful. Um, let's see. Okay, so we have a question around um, someone's son here is 16 years old and he's never had many friends. When he was younger, he would cry in the park. He still doesn't have a ton of friends, struggles a bit with expressing feelings and struggles with writing. Something has struck her as that this is not super typical. Is there anything she can do to find out, or what would you recommend here?
Yeah. So as a person who does assessments, I'm always biased to suggesting assessments. A comprehensive assessment, especially for teenagers, can be really helpful because a lot of what you've described can be due to many different things. So, for example, there could be some anxiety, there could be some sensory issues that are getting in the way, there could be some speech and language issues, especially because, again, language is very abstract, but the most abstract thing we can talk about, other than time, is emotions. And so, being able to understand what you're feeling and then be able to put them into words that is understandable for another person is actually quite hard. And so sometimes there, people are like, well, but he met all his language milestones and he was able to, do this and this. I don't think he has a language disorder. But then when we look at it in assessment, we're like, actually, he has these areas of difficulty that may not have been readily available to readily visible. So with a profile that you just described with your 16-year-old, what I would suggest is to find someone who is able to do a comprehensive assessment to rule out an emotional piece, a language piece, as well as an academic piece, because the writing could also be, again, a disorder of written expression, for example, a learning disorder. So the main thing, again, is that we want your son to be able to feel good about himself and be able to express himself, and understanding where some of these things may be coming from can help him understand also how to advocate for himself.
Love that. Super helpful. Another question here about autistic adults. So, Saj has heard about the lost generation, folks that were diagnosed later in life. They're asking what is driving some of that, this lost generation who wasn't diagnosed till later, and how do adults currently get diagnosed?
Yeah, that's an excellent question. So, their advocacy, the advocacy of this lost generation, is some of what's also led to us being more careful in taking people seriously and in looking more carefully. So it is true that higher functioning autism was not as well understood until relatively recently. So I'm, again, very lucky that in my professional life, this was better understood. And so that's kind of the way that I grew up professionally. But even, like, I'm sure we can all think of cases even in our own lives where looking back, we're like, oh, this person probably would have benefited from help or services, but it was never identified. So we are constantly learning more. Like right now, a big focus is also on women with autism, for example, which often is diagnosed again significantly later. Adults currently can get a diagnosis of autism, and so there are people who do assessments for individuals who think that they might have autism. And so you can find skilled ASD assessors who have experience working with adults. The main thing is, again, since it's neurodevelopmental, we do want to be able to look at early development, and this can be trickier for older adults whose parents, for example, may not be able to be interviewed by us, or they may not have archival data. But whatever you have, we would a skilled clinician would be able to work with. So again, we always recommend, it's not uncommon, for example, for me to see a child and then the parents say, I've actually always wondered whether or not I have autism, and that's something that I want to explore. And so we do refer families to and adults to assessments as well.
Awesome. Super helpful. From Caroline, what are your thoughts on autistic adults generally thinking negatively of ABA? Do you think ABA has changed for the better?
Yeah, it's really interesting because psychology, psychiatry, medicine has often there are many things, I think, in the past for a lot of different professions that, looking back, we can't believe we ever did. So if you think about like some of the things that you learned in history, for example, of things that we thought would be helpful. So even things like bleeding people, because we thought that this would help, and not realizing, of course, that this might cause other problems. Understanding where germs came from. And so unfortunately, ABA did have a negative reputation, especially in the beginning, for basically forcing people to conform very specifically and rigidly to what was considered normal. And there wasn't, again, an understanding of neurodiversity. as well as labeling behaviors as being bad rather than this isn't helpful to you or this is actually getting in your way. Again, we now, hopefully, most of us are trained to think about things from a functional standpoint. How is this behavior helping you, or how is it getting in your way? It's not necessarily wrong or bad. It's just, we again want you to make decisions about what you want to do, knowing what the effects are, the pluses and the minuses are. ABA, especially in the beginning, because like pure behaviorism is it can feel very cold, it can feel very sterile. There isn't, you can see videos of like how ABA used to be done many years ago that look pretty bad, where the individual is clearly upset and the person is not paying attention to that and is just moving on. So yes, there are many negative things about kind of, especially what might have happened in the past. I do think that ABA has changed for the better. A lot of ABA companies actually incorporate many other ways of working with children that are much more broad-based and much more developmental. And so there's always room for improvement, always in anything, and as well as taking in feedback from families to make things better. I do think that it is absolutely moving in a good direction, but there's always a lot of room for improvement.
Awesome. Super helpful. From Chris, are there differences between the types of services that schools provide versus what people typically get outside of school?
Yeah. So schools focus on helping a child access the curriculum. And so the services that are offered through school are much more narrow and specific in scope. And so a lot of times parents are like, well, but they're not always at school. So, we want to be able to expand these skills outside of just what we would use in the classroom, even though those things are very important. And so people usually seek services outside of school to help with the many different environments that individuals find themselves with, even though, again, a lot of things that you learn in school are applicable outside as well. So, but the school is bound to, their first consideration is how is this going to help the child be successful at school? And so their focus on like on OT, for example, and occupational therapy may be specifically handwriting versus something that a parent may be more concerned about, which is being able to do some activities of daily living, for example. So outside of school, you can get a wider range of services and a broader scope.
Got it. Got it. Super helpful. From Jessica, currently only receiving ABA. How should we go about getting services for my 4-year-old? I think similar to the social play question, Jessica, I'd recommend actually on our site, if you're in California, we have resources across of all different services types that you can search. It includes waiting list information, insurance coverage, you name it. And we're happy to help you with that also after this, if you let us know. Emmy, in your opinion, what are some of the best therapies or interventions that help children improve their ability to regulate their nervous systems?
Yeah, so working with a skilled occupational therapist, honestly, is really, really helpful. And so specifically, sensory processing is something that some occupational therapists are trained in because everyone has different specialties. And so occupational therapists can be really, really helpful. There are lots of other therapies as well, like mindfulness types of things, mindful movement, yoga, those kinds of things. Again, helping a person become more attuned to what's going on for them inside and how that links to their behaviors is a key part of that. And so this can be done through an occupational therapist. This can be done through a clinical psychologist or a mental health clinician who does kind of that mindful movement types of things as well. But if it's a significant area of concern, if there's a lot of dysregulation, we often suggest to consult with an occupational therapist first.
Awesome. Super helpful. Question from Austin was around how soon can parents tell that a child might be autistic?
So honestly, some parents can tell very, very early that something isn't quite right. And so again, in my practice, I primarily work in assessment. And so I've seen thousands of families. And so I think I have a wider range than, than what normal people may see. And I see a huge range. Some family members, like from the date of birth, they felt something was off. They just didn't feel as connected. And then usually, though, you start realizing that something may not be quite right with development in the first 2 years or so, sometime in between there. And it's usually often because of missed milestones. Although some families do report that they notice things like not making eye contact or those kinds of things as well.
Got it. Super helpful. Can you share why women are diagnosed so much less frequently than men?
Yeah, so there's actually been a lot of study about that in the past couple of years, and what the research shows is that women tend to be very good at what's called social camouflaging, and so they are very good at looking at other people and copying them, even if they don't completely understand like what exactly why. The difficulty then is that what we see often in women is a lot of exhaustion. So because you feel like you're putting on a front at all times, and so this is part of it because they're hiding it a lot better. So the median age for girls to be diagnosed with autism is actually 7 rather than with boys, which is a lot earlier. And so we, as an assessor, again, I tend to see girls later. So not even 7, sometimes more like 11 or 12 when they're starting to hit middle school and those social skills are really starting to take off. And their lag, they can't camouflage or fake it as much. And so then they start having symptoms of anxiety or social withdrawal, and people think that they're depressed or they're anxious. And then you take a closer look and you're like, actually, what's underlying it is the fact that they're working so much harder to try to get by.
Mm-hmm. Got it. That makes a lot of sense. From Daniel, a meta-analysis of autism interventions by UT Austin is Project AIM. I'm sure you're probably more familiar than I, but found that many studies fail to implement rigorous methodological standards or designs, such as randomized control trials. And so no intervention, including ABA, has produced significant effects, according to their assessment in 2020. And additionally, no research has been done as to the real emotional or mental impacts of the interventions. Shared Daniel, I know I've heard some about this too. Do you have a sense of how confident we can be in the different interventions that are available?
Yeah, I mean, it's a great question, and I think this could be a whole, other, like, honestly, much more. We need more money, we need more time, we need more resources to be able to answer a lot of these questions. What I often say to families is understanding, and this is why we have talks like these, understanding where some of these behaviors come from because parents are the experts of their children. You know your child very, very well. And then my job as a clinician is to work with you, the expert of the child, to put things together to again remove barriers. And so the difficulty also with these kinds of methodological designs is several fold. So I'm trying to not go too deeply into that, but mainly people should be able to explain to you what they're doing with your child or the individual and why, and be able to measure what is changing and how things are improving. Because as a family, you often have things that you want accomplished, right? You have goals that you want to reach. And so your treatment team should be able to say, this is what I understand of your goals. These are the things that I think that are getting in the way. This is how my intervention works on that. And this is how we measure it. So that's how we have confidence that what we are devoting our time and our resources into is working. Just because, again, waiting, unfortunately, for a lot of the methodological surety is just not time that individuals have. And then, of course, it's advancing the dialogue and making sure that we're advocating to get better surety of what, again, we're investing in. I know that's not like a. I wish I had a better, like, neater answer for you, but
No, you did great. Thank you, Melanie. Cheryl, I see your question here about your daughter. Her daughter was given a PDD-NOS diagnosis at 18 months and hasn't been reassessed since, is wondering if she should go to the regional center or to her doctor. Her daughter's much like the other question, where she doesn't have friends and wants them so badly, and Cheryl's looking for services where she can work in a group setting. Melanie, do you have a sense for that? Okay, perfect.
Yeah. So the regional center, again, just like schools, has a very narrow scope that they offer. And so higher functioning individuals, unfortunately, will often not get any services from the regional center because you have to basically be IDD. You have to have an intellectual developmental disorder on top of the autism. And so higher functioning individuals with autism, most of the time, unless they qualified when they were younger and you could see more delays, will not qualify for regional center services. As well as the regional center supports more like living, rather like residential things and like respite, rather than direct services. So my recommendation would be, especially because your daughter's a teenager now, would be to get a reassessment through a clinical psychologist, or basically another comprehensive team. Because again, just like the 16-year-old boy that we were talking about, there are many things that could be getting in her way of being able to meet her goal of wanting to have friends and wanting to have that social piece. So getting a baseline understanding of what barriers might be there, I think would be really helpful in designing a comprehensive, program to help her be successful.
Mm-hmm. And for anyone who has specific questions like this, like Cheryl and others who've asked earlier, Dr. Hsu will be responding to specific questions in our community. So not only can you join for the Amazon gift card, but also for help getting answers to some of these questions. If for some reason we run out of time in the last 10 minutes or you want to continue the conversation, it's all free again for families. So all you need to do is sign up and join the community. Moving on here, for younger children, is it best to start in public elementary schools or private schools for children on the spectrum?
Yeah, that's also a little bit harder without a little bit more information. So there are some specific private schools for children on the spectrum, for example, that can be really helpful, but it also depends on what the profile of the child is. So there are definitely times where public school is more recommended, and sometimes where private schools are more recommended. So I think it would be better to have a little bit more information to be able to answer that better.
That's a good point. At a high level, what would sway you if there are things that might sway you to public versus private? Are there any big things that might tip you one way or the other?
Yeah. So most of my work is with families with Medi-Cal, and so private schools are just not, unfortunately, as accessible. And so there are times when we can push the public school to pay for private school. So I think that's the mindset that I'm often coming from. The great thing about private schools is that sometimes, again, their class sizes are smaller. And so if sensory issues, especially like sound sensitivities and kind of movement sensitivities, are a really big dysregulating factor, being able to be in a smaller, more intimate setting can be regulating, which again makes the child more available for learning. So that would be something that we would recommend, especially if there are a lot of specific concerns in a lot of the areas of development that we talked about. Sometimes a private school has more of those specialists, whereas in the elementary school, you're sharing with a lot more families. And so for children who have more concerns, and especially when they're very young, we always, again, early intervention is key. Building a strong foundation in elementary school is key, not only for learning, but also so that the child doesn't learn to hate school. And so a lot of times private schools, when you have more areas of concern, can help build that foundation because there are more resources available. But unfortunately, sometimes it is a fight of who's going to help pay for it. And in which case you can get an excellent setting as well in a public school as well, but just working with your team.
Super helpful. Thanks, Melanie. From Daniel, do you have any thoughts on the pathological demand avoidance profile of autism that's currently recognized in the UK, but not the US? His eldest son and wife seem to match the profile.
Yeah. So Pathological demand avoidance, as you said, is recognized in the UK. There's a lot more research on it in the UK. There's a lot of families actually that do come asking about that diagnosis or that profile, basically. So I think it's an interesting way of kind of thinking of that dysregulation that we've talked about. So again, behaviors don't happen in a vacuum. And often if your nervous system is a little bit more inefficient, you have less gas to spend on other things, as well as the fact that with autism, it can be difficult sometimes to be able to understand what is the most salient or what's the most important thing to devote your time to. So sorry. And so, um, so because of that, um, the pathological demand avoidance is again that like extreme resistance to doing non-preferred tasks. And so it does come, my understanding of it again is that regulation piece and kind of being able to, again, reduce the demands on the system in general so that they have more capacity to handle demands, because sometimes again you don't understand what's important. So for example, if you're eating dinner and I run into your dining room and say, oh my gosh, you need to leave right now, you're going to be like, no, I don't want to. But then if I say, because there's a fire, you'll be like, oh thanks, yes, I will leave. So understanding that context is really important, but also having the space to be able to make those decisions rather than being like, I can't handle this right now. Like when someone puts yet another thing on our desk, for example, and we're like, I can't handle this right now, I'm not going to do this. So again, because we're in the US, we don't have as much information. And so my understanding of PDA is a little bit more, I think, shallow, but that's my understanding of it. I do think that there's more talk of incorporating that more into our understanding of a profile of autism, but I do understand it from like more of a regulatory perspective.
Got it. Thanks, Melanie. From Marlene, what's the difference between ADHD and being on the spectrum at level 1?
Yeah, it's an excellent question. So ADHD is also a neurodevelopmental disorder, and there are a lot of overlaps between autism and ADHD. The main thing with ADHD is that even though individuals with ADHD often have are less socially mature sometimes, and have difficulties again with always attending to what's going on for the other person, once you have their attention and once they are regulated, so they're not hyperactive or being impulsive, their social understanding is intact. Whereas with autism, even when regulated and even when you have their attention, that social understanding is more difficult. So that's why we say the hallmark of autism spectrum disorder is that social emotional reciprocity. So we often think of autism as, in some ways, the disorder of last resort. Is there something else that might be getting in the person's way that is causing them to have that social disconnect? With ADHD, it's because you're not paying attention enough, or you're paying attention to the wrong thing, and that you're dysregulated, and so that you're not able to be present. But once we regulate you and you're paying attention, that social understanding exists.
Got it. Super helpful. Follow up here. So how would you know whether your child needs more than just ABA? Is it something your pediatrician would tell you? Or for example, how would a parent or any caregiver know that speech or OT might be helpful?
Yeah. So again, my biases are going to come out in that this is why we have comprehensive assessments to really understand where these barriers are and how to help them. So I often work in an interdisciplinary team where I am very lucky to have access to a speech and language pathologist and an occupational therapist and an ed specialist. And then we all work in conjunction to say, these are the things that are getting in the child's way, and this is how we think those barriers can be removed. So the pediatrician, so again, psychologists, we're trained to do that. We're trained to, again, to look at all the pieces and then put it all together. Pediatricians are amazing and very much respect what they do, but that isn't necessarily how they're trained to think about these things. They look at symptoms and they say, okay, let's do this or let's do that. And so working with a team and working with a psychologist can be really helpful to, again, operationalize the problems to say, okay, this is the impact of functional communication, which would be speech. This is the impact of sensory motor issues or regulation, which would be OT. This is the impact of emotions. And then from there, develop a comprehensive plan.
Mm-hmm. Super helpful. I know we're coming up on time here. We'll take a few more questions. Let's see. So as a parent who's getting a treatment like ABA, how would a parent know if the treatment is working?
Yeah. Are we making progress towards the goals?
Mm-hmm.
So again, one great thing about ABA is every 6 months they're supposed to be, and actually even more than that, they're supposed to be doing an analysis of how are we moving toward goals. It's the same in IEPs or individualized education programs. There are goals, and then there's a breakdown of what constitutes movement. And so as a parent, I would recommend that you just work in close conjunction with your treatment team to say, what does this mean? Because sometimes the data points don't always make as much sense outside of the session, to be like, how is this movement towards the bigger goal? And so checking in with your team can be really helpful.
Mm-hmm. Got it. Love that. Another question here. Is it typical for a woman to have more than 3 kids on the spectrum? I have my second 3-year-old is stimming a lot. I'm always asking her to stop and I feel bad. I'm not sure what I'm going to do if she has it too. So just, is it common?
Yeah. There is a large heritability. However, there are many reasons why individuals engage in certain behaviors. And so sometimes it's because there are many things that can lead to that. It can be really overwhelming, absolutely. And so we would definitely encourage you to get support and to also get interventions, especially because the earlier you get interventions, the better the outcomes are. And, all of it is about, again, making sure that we are giving our children the tools they need to be successful. And the earlier we do that, the less of the kind of sequelae or the accompanying things that we see. We can minimize some of those things.
Got it. Melanie, thank you so much. And we just really appreciate your time and thank you for the work you do. I know the families are so lucky and really grateful for your work and for your time tonight. And for anyone who has additional questions, I apologize. I see there's some account creation issues going on, but we will make sure we have all of your emails. We'll make sure to follow up and let folks know how they can join the community where they continue to ask questions. The conversation doesn't stop here. So thank you all so much for joining, and we will hopefully see you again in a future event soon. Thank you.